Good evening, everybody. Nick Thompson here, the Gut Doctor. We're going to be talking about health and herbs and life and how to optimize all things good. And this evening, we're going to be talking about anal glands. And that's what we're going to do. I'm just going to waffle for a little bit, and you're all thinking, "Oh, you normally waffle for half an hour," but I'm going to just waffle for a minute to allow people to join the show, and then I will introduce properly, and I'll go over to the slides. I've got some slides organised for you this evening. Laura is there on my right hand side, and she has sent a question, and I will look at that when we come up next. Now is actually a good time. If you've got any burning questions, we can do those while we're waiting for people to come and join us. So if you've got any, there's Laura. Laura, please remind me to look at your question at the end, and that'll be great. So people coming on, that's really, really good. I think without any further ado, I'm going to get the show organized. The next show, by the way, is June the 20th, and we're going to be doing pesticides and wormers. Oh, look, my magic machine, my magic screen is apparently, if you do, I think it's like this, it will do this. No, it reads the screen and puts up funny images, depending on what hand signals you do, which is really quite remarkable. But there you go. So that's what we're going to do. Let's get on with the show now, guys. So what I need to do to make things work is to go like that, and then go like that, and then I'm in the corner, and I will go over to here. And Laura, if you can just give me the thumbs up to make sure that you can see the anal glands there. Let's go play from the start like that, so it all looks very posh and professional. That would be great. So this evening we're going to be talking about canine anal glands, and Laura says we're good to go, so that's fabulous. Thank you, Laura. Canine anal glands, pretty simple things, and when they work, you don't even know they're there. But when they don't, it can be a problem, every week, every month, with not a small number of dogs, actually. So let's jump into that. A little warning, just to say, it's going to be fairly graphic. We're going to be talking about bums a lot, or we're going to be talking about stools and what have you. I'm sure you're more than hardened to such things, but just a little warning that we're going to be showing a lot of bums, essentially. Okay, so what's the problem? Well, this is really a common sign when dogs have anal glands. Okay, you may have seen your dog do this. Some people don't recognize that it is actually a sign that the anal glands might be a problem. Go, oh, the dog's sledding across the living room again. But actually, the dog has got an itchy, technically it's itchy perianal area, and there are often things that you can do to help so that it isn't itchy, because it's no fun having an itchy bum, obviously. So let's look at what they are and where they are. So this is a dog's anus, and either side, internal to the skin and tissue, you have these two little glands. So anatomically, that's where they are. I always think that they're at about 8 o'clock and 4 o'clock if you look at the perianal area as being like a clock face. Okay, so from 4 o'clock on the right and then 8 o'clock on the left, and that's how we vets find them. If we look in a little bit further, we see in the center there we've got the anus, and then we've got there's an external anal sphincter And just inside that external anal sphincter, you have these anal glands, which help them to be squeezed as stool is passed. And that's really one of the most critical parts of the whole story. We'll just have a look. I've got another little diagram there. So if you look at this, so again, this is where the anal glands are. We call them anal glands. Some people call them anal sacs. And if we look then from above, yeah, so the diagram below is looking down. The dog is maybe between your knees, and you're looking down, and so coming into the anus, you've got the rectum, which comes off the colon, and then the rectum terminates in the anus, which means that stool can be selectively passed, because you don't want to be passing it all the time, because hygiene and disease and what have you. So we selectively, also dogs will use placing stool for kind of marking territory. So they want to mark their territory in specific spots, not all over the shop. So looking down, and these are the two anal glands. I always think they look a little bit like figs, and in a small dog like a Chihuahua, say, or a little Yorkie, they're going to be about the size of a baked bean, maybe a slightly big baked bean. But in this, I saw a Vizsla yesterday, and that size dog, and she was probably about 26 kilos, and she had pretty full anal glands, and they were this kind of the size of a small walnut. Yeah, I remember they were pretty full. But if you find a really big dog, a Leon Burger or a Pyrenees, something like that, they're going to be even bigger. They're going to be fullish. They're going to be about the size of a walnut. Okay, and so the idea is that if the vet does have to intervene, you squeeze them, and you squeeze them such that the material, if it's not too solidified, passes down the anal sac duct, and the opening is actually, it's kind of where it's kind of midway down the anus. Now the anus in the dog is about half to 1 centimeter, and about halfway within the folded tissue, you've got these tiny little openings. And that's quite important, because sometimes with dogs who have recurrent anal gland problems, vets are able to put a cannula back into that anal sac duct and instill material into the anal gland to help with infection or inflammation. We used to use a kind of an ear preparation, actually, to go in. It contained a bit of antibiotic and a bit of steroid, and that was just treating it very locally. So for really persistent problems or persistent inflammatory issues, we used to use that. The ear product. You can talk to your vet. It's not a licensed use of the product, but can be very useful, because it means you get a high concentration exactly where you need it. You don't have to put antibiotics and steroids into the entire dog just to reduce inflammation within the anal gland. So it's all very interesting stuff. And the key thing, and you probably all know this, but I'm going to go through it anyway, because it may not be kind of front and center of everybody's mind, is when a dog squats to pass a normal stool, that stool, because of the firmness of the stool, and that's important, I'm going to tell you about that in a bit, and because of the musculature around the anal gland, they work together to evacuate the contents of the anal gland, which is in the normal course of events pretty watery. It's only when it becomes infected, it can become what they call inspissated. It becomes kind of much thicker. And if that goes on for any length of time, or if the anal glands are blocked for any length of time, you can actually get just all that material solidifying completely, and then it's very difficult to squeeze out, and you would have to try and flush it, perhaps. So the idea is to try and not get to the stage where you can't squeeze those anal glands easily. Okay, so scooting. Scooting in a dog, this is where they pull themselves along on their perianal area, and many people think that it's due to worms. You know, they'll see the dog scooting and they go, "Oh, the dog's got worms. Let's reach for a pharmaceutical worm," and they'll whack it in, not knowing whether it is or not. But in fact, as you'll see at the bottom there, I think it's rarely worms that cause scooting in dogs. Okay. By far, going to the top of these three, by far the most common cause of scooting in dogs is because they've got anal gland issues. They're either inflamed, or they're full, or they're infected, or all three. And so that is by far the biggest issue. However, there are many dogs out there who have sensitivities. The main sensitivities are to pollens, or to indoor allergens, or to food. And classically, these can manifest anywhere on the body, but they often manifest in the ears and rears. The Americans talk about ears and rears. And I would suggest, though, that we see itchy ears, rears, and feet can often be these signs of these sensitivities, these three sensitivities. So how do you differentiate between an itchy perianal area and uncomfortable anal glands? The answer is that if it is an anal gland problem and you get them very gently, very carefully emptied, then you will see an immediate improvement in in those scooting symptoms. And if it's a fairly minor problem, that can be it. No more scooting. If the dog's had their anal glands emptied quite frequently, then sometimes you can get to the stage where you empty the anal glands. Dog is better for 1, 2, 3, 4 weeks, and then start scooting again. And these are the guys who have to go to the vet every month to get their anal glands done, and it's not ideal. Because what we find is that with anal glands, that the more they are emptied, often the more they need to be emptied. So the trick is, get that pup producing really fabulous, solid, firm poos for them, such that they look after their own anal glands. We've got our dogs here, and I'm not gloating, I'm just saying, just as an example, because we feed raw, and I'm very proud of the fact that my dogs have great poos most of the time. And so between them, so Jet is 8 months now, Mouse is 3 and a bit, Bluebell is 5. So that's between them. They're about, let's say, about 9 years. So we've got 9 dog years there. I've only emptied Bluebell's glands once. Okay, so really gently, plenty of lube to get those anal glands emptied, and she's never had a problem again. That's the ideal scenario, that you can recognize it early and just very gently empty those glands such that they just return to normal, and that's it. So there you go, the meaning of scooting. However, not all dogs scoot. I've seen dogs itch their backs, like this lab just here, their backs, their tail heads, their tails. I've seen them itch their legs anywhere from that's this guy here. He's chewing his stifle. That's what vets call knees on the hind leg. Their stifles all the way down to their toes. Yeah, I have seen dogs chewing their feet because they've got anal gland problems. I've also seen them chewing up into their groin. Yeah, because if you think of it, that's the direction that the sensation is coming from. So if you've got a dog who is itching like that, you've got to think fleas as well. Okay, because so have a good look for fleas and make sure that they're not there. If you've got a dog who's chewing here, they could have, arthritic pain in the joint, or some kind of sensitivity. And equally there, it could be some sensitivity. If it is a sensitivity, it's usually front feet and back feet. But I have seen dogs with atopic dermatitis who've only had front feet itch, and perhaps ears, something like that. So there are patterns to these things, but you just have to keep quite an open mind as to what might be happening. Worth talking to the vet and getting an experienced eye to help with interpretation of what might be going on there. Okay, so what are the causes of anal gland problems? So the number one would be diarrhea. Now, forgive the graphic photo, but at least we've got a puppy between us and a pile of very runny poo. So if a dog has very loose stool, even for 2-3 days, that doesn't have a kind of squeeze effect on the anal glands, and therefore even in that short period you can get a buildup of material in those anal glands. So if the dog has a period of diarrhea, then just watch them afterwards just to make sure that they're not scooting, because their anal glands are filled up. And really, with the thing about anal glands, think about most disease, in fact, the earlier you get in with gentle, effective treatment, the better it is. Just a little word on diarrhea, by the way. I have a scale. There are a number of scales. There's the Bristol stool scale, but it's a 7-point scale. I don't really like it. I've got 10 fingers, so I like to count things in 10-point scales. So with the Thompson stool score, what I say is that 10 is a perfect stool. It's kind of like a sausage just off the barbecue, and you can pick it up with 2 fingers. It's got a bit of give, but easy to pick up with even 2 fingers. A 0, this guy would be about a 0. It's kind of like gravy or soup. Okay, it's just brown, horrible, watery material that has 0 form. So that's a 0, and a 5 would be something like chocolate blancmange. Okay, so if you've got an acute diarrhea like that, there's 0 squeeze of the glands, and you can get a bit of filling of the anal glands. If, however, the dog is producing, ignore the color, because this dog had a bit of a pancreatic issue, but just look at the consistency. There is some degree of form in that stool. Forgive me for the graphic photos, but I did warn you at the beginning. But so there is some form to that, but you can see that it's you're not going to be able to pick it up with 2 fingers, and so we'd call that maybe a 6 or a 7 on the stool score. Okay, and if the dog is producing that's not diarrhea per se. It's not watery diarrhea anyway, but it's not really got the firmness to again have that internal squeeze effect against the anal muscles. So the onset of anal gland problems might be a bit slower because there is degree of squeeze effect with this type of stool, and I'll tell you, there are a lot of dogs who are around a 6, 7, 8, and owners think that's perfectly normal for that dog. And I think that's a real shame. It may be normal for that dog, but I bet it can be improved by improving the diet. I'm a fan of raw food, and I would just say, listen, you've got to get that dog onto raw food. If you've got a dog who's got a chicken sensitivity, for example, and you feed them raw food based on chicken, they may still have a poor stool consistency. But that doesn't mean that raw food is rubbish. It means that you're feeding a dog with chicken sensitivity on a chicken-based food. So don't use that. Use rabbit or chicken. Not chicken, rabbit or venison or duck or something like that. Even turkey, okay? Chicken and turkey. I've had that question a couple of times this week. Chicken and turkey are sufficiently evolutionary different to the body sees them as very, very separate, even though on the plate they look very similar. Okay, it's about the evolution of those chicken or turkey proteins, and they are pretty different. So long term with soft poo is not good for your anal glands, or short term with really runny poo will give you a much quicker anal gland fill effect. And that's what happened with Bluebell. She was a bit loose for a few days and got over it. She was fine, but then a week or two later she started scooting. So we just did her anal glands. So what is the answer to improving stool consistency? So number one, so I'm showing a picture of green vegetables there for a reason, but the number one thing would be just make sure that the protein source that you're feeding absolutely works perfectly for your dog. So if you're feeding a lot of chicken and the dog's continually at a 6 or a 7 on the scale, change that out for venison, duck, rabbit, goat, pork, fish, one of those slightly unusual proteins, even lamb, and just notice to see if that improves stool quality, because it may be that the dog has just a degree of sensitivity to the main protein that you routinely feed because it's easy to get from the local pet store or something like that. If, however, the proteins that you're feeding, are producing good quality stools, but you want to add a little bulk, a little volume to those stools, then getting lightly cooked greens and blend them into a kind of a smoothie, and you can just add that to the food, mix it in, and they won't be able to go, I don't like all these vegetables. You'd mix them in at about 10 to 20% of the volume, lightly cooked, or if you can ferment those greens, then that's really, really, really good as well, because by blending, light cooking and blending, that breaks down the cellulose and breaks down the structure of the plant. And the same thing happens when you ferment. There's a lot of breakdown of the cellulose, and it means that they're more digestible. The goodness is more digestible. With a fermented product, a sauerkraut type thing, you've also got the fermenting bacteria, the lactobacilli and what have you, which are very beneficial for the gut. So one answer is to increase the stool volume. If the stool is okay, it is the green vegetables. The other, the vetty way of doing that is a product that we use at the practice here. It's called NutriFiber, and it's basically just a kind of a simple way of adding fiber for increased bulk to a pretty good stool, but where you just want a little extra volume to that stool in order to help with anal gland health. So that's an easy one to get hold of. talk to your vet about that, or email me and I can get you some, no problem. More and more, though, within the Raw Pet Medics, every Tuesday at 7 o'clock, we get together on Facebook. Dr. Connor Brady, Dr. Brendan Clark, and I get together and we talk about all things nutrition and food and raw food and health for dogs. And we're drifting more and more to thinking that one of the ideal fiber sources for our dogs is in fact collagen, cartilage, and fiber derived from chewing material. So this is Bluebell. She's now 5. This was her at about 1 year old. And on the left there, she's eating that's a chicken carcass. That's a brilliant thing for dogs just starting with raw food, because they're really big, but they're really soft. And you can see she's pretty happy with that. And on the on the right, that's a pig's trotter. Okay, that's a fresh pig's trotter, and just fabulous. And you can imagine the amount of kind of cartilage, tendon, ligament within that kind of structure. And she would eat that, and that's a wonderful source of fiber for dogs as well. The other, classically, we say liver loosens the stool. So if your dog has a tendency to a bit of constipation, you can just add a wee bit more liver to the food, and that can help to loosen. So liver loosens, bones bind. So you can just increase the bone content of the food that you're feeding a wee bit, and that can be very helpful with improving stool quality. And if you need the volume, you've got your veggies and things like Nutrifibers that can be quite useful. So there you go. It's all about fiber going in, but fiber doesn't just come in plant form. Okay, humans use plants for fiber. Dogs have historically used animal fiber for really good stool quality. So there you go. That's just me showing off beautiful Bluebell. So when anal glands either become blocked because they're a bit inflamed, or they are inflamed for other reasons, maybe there's an infection in that gland, they can become impacted, and this simply means that they can't discharge. The anal glands should discharge to a certain extent with every good stool that's passed. If that happens over a number of days or a number of weeks, then you'll get this impacted anal gland where it's full of material, and that's when you'll need those anal glands emptying. If the dog is sore, or you don't want to, most people don't want to empty anal glands, and I'd say if there's even the slightest chance that gland is infected, don't touch it. Get to the vet, because you can damage the glands, and if you damage the anal glands, at the worst scenario, they can burst and cause a hideous infection in that general area. But what is quite easy to do is that you can squeeze it such that you deform and you kind of just change the shape and the functionality of that gland, so that when the stool then passes after it's recovered, it's a bit distorted and it doesn't work so well with the muscles on the outside and the stool on the inside to have a nice anal gland squeeze. And these are often the dogs who need recurrent anal gland emptying. Okay, so that's an impacted anal gland. If you're really unlucky, I'm not sure whether I've got a picture. No, I haven't. If you're really unlucky and you just don't notice it, then those impacted anal glands, if they get really infected, they will cause a fistula where the pus within the anal gland actually seeks to exit the body, and it usually comes out in that perianal area. Really, really sore. That's antibiotic territory, I'm afraid. There are good homeopathic remedies, silica and heparin sulf and gunpowder, believe it or not, can be useful depending on how things appear, but will need some treatment if you get to the stage where you get an anal fistula. Not fun. Emptying anal glands, most people don't want to empty their anal glands, and I can totally understand that. There are two methods. There's the external method, as you see here. Looks like a vet nurse, perhaps, who's going out from the outside, and what you do is you try and get in behind the anal glands and then just gradually kind of milk them outwards. In all but the fattest dogs, you can do that in most breeds. You can do it with most cats as well, but be very, very gentle, because if you damage it, you've set yourself up for life for having to repeat. So be careful. What I tend to do is I'll use, I couldn't find any good pictures of vets expressing anal glands, but I can understand why. The internal method is you'll actually put a gloved finger, well lubricated, into the anus, and you'll be able to feel to behind the anal gland, and then just gently, very gently, taking your time, be able to express first. I do first the left and then over to the right, and I like to do that because I can feel the size, position and fullness of those glands. And then as they empty, I can check that there aren't any sinister tissue, any growths within the gland once the anal gland is emptied. And I don't think you can do that very effectively by feeling from the outside. Okay, so we do it. Also, if you're doing it from the outside, you can't always tell what's coming from the right and what's coming from the left. But if you do the internal method, and that's really more of a vetty job, you can report on what's happening with the left, what's happening in the right, and then if you have to see the dog again, you can compare and contrast that using that left-right differential, which is very, very useful. I find most dogs will tolerate that. And the trick is just to really take your time, reassure the owners, get the owners to support the dog, and yeah, I cannot iterate. Take your time, do it gently, and Bob's your uncle. So overall, as is often the conclusion with our talks here at Gut Doctor, general health really is the most important thing, because if your general health is good and your diet is good, and I'm a fan of raw or lightly cooked, but mainly raw, then the stools will look after themselves. Therefore, the anal glands will look after themselves, and you'll be in great shape, and you won't need to worry. The normal dog does not need their anal glands. I would say most normal dogs may get their anal glands done once or twice in a lifetime, would be pretty typical. So big thanks to Vermex. They do these herb blends, and we use those on the dog's food just as a sprinkle on top. Really, really nice. So definitely worth having a look at that. It's a nice organic product, so ecologically definitely in the right direction there. So all very good. So I'm going to come back to you now, because I can't see your questions because I'm here. And Marie Conway, you go to the top of the class immediately by saying Bluebell is lovely. Right, I'll just hide that. There we go. Okay, let's have a look and just see whether we've got any questions. Diane, lovely to see you. Oh, we've got Diana as well, and we've got health with a capital L, and Lucy is here, and Marie is here, and many others. So that's great. Do chime in, guys. There's many others there. It's just that some people are more like to ask questions more. So so Diana says recommendations for infected one anal gland, no scooting, no discomfort. Infected one anal gland. Okay, I'm not quite sure what that means, but I imagine it means that one anal gland is infected. So the options there, sometimes you'll just get away with one or two gentle squeeze. If it's too infected to squeeze, it might be sedate the dog, flush, fill with an antibacterial and anti-inflammatory solution, and that will often do the trick. I can't remember the last time I used oral mouth antibiotics for a dog with an anal gland problems. I would always go for local treatment. Yeah, putting the material into the anal glands. We used to do it all the time in practice. I'm not sure how fashionable it is to do these days, but it's not a difficult thing to do. And you can do it if the dog's not too sore. You can often do it on a conscious dog. Yeah, in all but the most objectionable dogs, you can do it with the conscious dog. Yeah, it's just a bit like doing the anal glands. Let's have a look. Yep, Diana also says about Stool Right. That's another product. This is the stuff that we use. This is the Nutrifiber stuff. Nutrifiber is another one by Connor Brady. He's at Dogs First, and that's a nice little product. And let's have a look. And Diana also says that Bluebell is lovely. That's great. What does it mean that it's half normal, half runny? That means the diet's good, but not quite. You need to do a bit of work, perhaps a bit of probiotic. We at my practice on the Holistic Vet Shop, we use Fido's Flora. It's a nice probiotic, and there's another product we use called Gut Soothe, which does what it says on the tin, and it is a pre and probiotic as well. Let's have a look. Lucy Gutteridge says blending is a great idea, as my dog will not blending. I think she meant blanching or blending. Right. Yes. So yeah, putting them in the blender, chop up. Put them in the whizzer, and that is a great way, because some dogs would, if you put spinach in the food, they'll just leave it to one side. But if you blend it up as a with a bit of either water or bone broth or something like that, it can go in really well. And Diana says she uses the Vermex products. Good for you. Yeah, that's good. Hillary's jumped in here. What she said. Let's just put this up. My small mixed breed rescue girl is raw fed with extra veg, plus a little bran and oats. She has perfect poos. Was fine for 2 years, but now in the last few months needs glands emptied 3 times. What more can I do? I would. Okay, so Hillary, thanks for the question. I would just make sure that all the proteins you're feeding are definitely spot on, and just make sure that one of those proteins isn't making her drop down to a 7, and and then the rest perhaps might be keeping her at a 10. So that's the first. Yeah, that's the fundamental stool quality. If it's that the poos maybe are too small or just too narrow to have a really good, then you'd be looking at either Stool Right or Nutrifiber or the veggies in order to just increase the bulk. Also might be worth looking at the amount of bone going in. We don't want her constipated. Yeah, we want her at a 10, not an 11 or a 12. Yeah, 11 is mildly constipated, 12 is pretty substantially constipated. We don't want to go there. So I'd be thinking along those lines. Thank you. Zinga says, my dog had a perineal adenoma removed. Would emptying anal glands be painful if she ever needed them emptied? Not necessarily. If it was, removed, there's not too much scar tissue, and the anal glands were left, and the anal duct is not blocked by scarring or anything like that, you won't necessarily have problems down the line. So that's good. Good luck with that. Fingers crossed. Let's have a look. What does Eileen say? Eileen says, stools from concrete to normal depending on how much bone she has. Never needs to strain to poop. Yeah, beware the concrete. If you've got concrete stools, every now and again you'll get away with it, but if you've got pretty routinely concrete stools, then some fiber would probably be a good idea. Some kind of plant type fiber would be a good idea. Eileen, thank you. Okay, and then our last, let's have a look. Last question. My dog keeps getting abscess. What do I do, please? Okay. If you've had one abscess, that can damage. We were talking about just changing the shape and the function of the anal gland. It might be that the first abscess set things wrong, which is why you're getting recurrent abscesses. I think in the short term, I would be doing regular, this is my motion for squeezing glands, doing regular anal gland emptying, and I'd be looking at raw. I'd be looking at modifying the bone content, modifying the plant and animal fiber content to try and give the dog a consistent, high volume for the size of dog. Yeah, a big Great Dane poo is very different from a big Chihuahua poo, obviously. Okay, so it depends on the size of the dog. Okay, because different sized dog have different anal diameters and what have you. Let's have a look. I'd said it was the last question, but I lied. Is your poo chart on your website? No, it isn't really. I've got it written. I do send it to clients every now and again, but it really is as simple as that. I should do one, shouldn't I? Really, I should get Ellie, who's a designer, a digital designer, to do the stool chart. Yeah, that's a good idea, Diana. I'm running around like a madman all the time these days, but it is a very good idea. So it really is as simple as that. Down at the bottom end, you've got water. Down at the top end, you've got a perfect sausage, and in the middle, you've got blancmange. And so you can kind of just grade the poo in between there. So, I can't leave this one go. Zenga says, if blended veg, would you do raw or blanched? I would do blanched. Yeah, I used to say raw, but I'm now evolving into a slightly cooked, because what we're trying to do is we're trying to emulate what's happening in the rumen, in the intestine of herbivores. Okay, and within the rumen and intestine, you've got a fermentation, you've got a digestion, a breakdown, a fermentation process, and I think that light steaming or a fermented kind of sauerkraut type preparation, that's closer to the inside of a herbivore than just blending the raw greens. So there's an evolution in my thinking over the time. So there you go, Zenka, all very good. Enjoy. I hope that's been useful, guys. I've really enjoyed it. I've kept you for 15 minutes longer than I should have. So I appreciate you sticking around. Come and see us again on the 20th of June, and we're going to be looking at pesticides, the overuse thereof. These are the drop-ons, but also the oral, the NexGards, the Bravectos of this world. We're going to be looking at the pros and cons of those, and we're going to be looking at wormers, pros and cons of pharmaceutical wormers versus herbal approaches to gut hygiene. So all to play for, all very good. Right, I'm off for dinner, and I will see you in a month. I hope that was useful, and really look forward to catching up with you very soon. So that's me signing out, Nick Thompson, the Gut Doctor. Have a lovely evening. All the very best to you and yours, and to, of course, to the dogs.